My name is Barra Fitzgibbon, and I am a COVID survivor. And this talk, if you like, is about my COVID-19 diary, really, and how it's changed my working career. So it's a diary. So officially, it should begin with a date. So I begin with Friday, the 13th, of March. So a call to 111, out of breath, hacking cough, high temperature. And 25 minutes later, a paramedic dressed in the biohazard gear shuffles up to the house, did her observations, oxygen levels low, temperature high, chest and lungs in trouble. Decision was made, we're off to Lewisham A&E in London. Now, within seconds, I was on oxygen, and within minutes, I had 2 cannulas inserted. I remember the paramedic saying, "I think you're going to be a statistic." Words of comfort, I don't think so. And not the most helpful conversation to have with the patient at the time. And she was the first of many faces I was never going to see for the next 12 days, which is the big downside of PPE. Now, I arrived at Lewisham A&E, and Lewisham A&E was both militant and brilliant. Everything was moving so fast, cannulas working overtime, bloods taken, drips attached, intravenous, you name it, inserted, chest x-ray done, test for COVID done. And then a lull in proceedings, and I was alone. And in my mind, this wasn't COVID until the test came back positive. And I didn't think about what was coming next. I thought maybe I'd stay in for a night for observations and then home. And that was the moment when a doctor walked in and began a conversation with this opening line: "Barra, I want you to know that we will do everything we can to save you." Now, I'm all for honesty, but this approach triggered fear and panic and a little bit of aggravation. I said, "Why would you say that? We don't know it's COVID. The swab hasn't even left the building. Should we not stay positive?" And I decided there and then that I didn't like her. And of course, it wasn't her. It was what she was saying and how she was saying it. She was convinced it was COVID. 3 signs: liver compromised, immune system compromised, chest compromised. And it was the way the infection was encroaching the chest that concerned her. She believed that this is the way COVID attacked the body. She said that even if COVID test came back negative, she'd insist on a second test. She was alerting ICU, so they were at least aware of me. She actually recommended that I go into ICU immediately, but they kicked it back, arguing it was too soon. Now, I regret getting cross with this doctor because she's obviously brilliant, and I'll come back to her. Let's call her the A&E doctor for now, so we remember. Her words scared me, but that conversation, albeit brutal, brought great comfort to me over the following and much darker days. And it was the line, "We'll do everything we can to save you," that eventually gave me some peace of mind. And I'll come back to her later because she's important. So I quickly processed that I was in Lewisham Hospital for the foreseeable, and the next job was to find me a bed on a COVID ward. Now, I don't know the ins and outs of how the NHS works, and it's very easy to criticize, and I don't want to. I'll merely give you the facts, and you can make up your own mind. Whether you have COVID or you're suspected of having COVID at this time in March, you are sharing the same ward. And when a nurse comes into that ward, yes, they're wearing PPE, but they don't change the PPE in between treating the different patients. So let's take the situation of using the same gloves to treat a patient with COVID and then moving on to treat a patient who doesn't. A possible scenario on these wards. Now, treating involves touching, taking temperature, administering drugs. It makes you think, and I'll leave it there. And let me give you the context for why I am slow to criticize, because these people saved my life.